Minister Scott Morrison, thank you for your time. Victoria has just declared a state of emergency. Is that required nationwide?
Yeah, this was discussed at the National Cabinet yesterday. As you know, that's the first time ever that a National Cabinet has been brought together. All the Premiers, Chief Ministers and myself convened that yesterday. One of the key issues they discussed was how states would move to that public health emergency status. I mean, it has different expressions and different laws in different states and territories, but it's effectively giving those states and territories powers to undertake certain actions and enforce them in managing the health crisis, and they all agreed that they'd sort of move towards that footing over the next few days, consistent with their own laws. Some have been there for a while, like Queensland. South Australia moved yesterday, Victoria's moved today, so we can expect that to continue, and that's being done in a coordinated way between the states, which I think is enormously helpful.
Just on the bans that are in place now, Prime Minister, self-isolation from people arriving at our airports, how will that be enforced?
Well, up until now, I mean, this has been in place now for many weeks for a number of countries, and that's been working extremely well. And that wasn't mandatory at that time. I mean, for those people who are coming home from China, coming back from places like South Korea and so on, that has worked extremely well. And we're talking about tens of thousands of people who've been subject to those arrangements. And now it moves to a much more universal imposed isolation, and this will be backed up by state and territory laws. Now, obviously, police resources are not going to be diverted to stand outside people's homes if they're self-isolating. That's ridiculous. But what it does mean is I think all the community has a role to play here. As I said yesterday, if someone turns up to your workplace having been overseas, well, obviously they're not complying, and that's just not a bad call. It's actually against the law, and so people should cooperate with that. But I must admit, over the many weeks that these arrangements have already been placed for many returned arrivals, that they have been doing the right thing, and people have been supporting them in the community.
But could arrests be made, fines imposed?
Well, fines can be imposed. I mean, it all depends on the state and territory laws and how they see fit to enforce that. But those sort of sanctions are possible, that's right.
Are you considering the limit on indoor gatherings? We're talking about aged care facilities in particular, perhaps new restrictions on visitations, weddings, movie cinemas. Is all of this being considered?
Yes, it is, and we flagged that. I flagged that yesterday. I mean, right now the priority for the medical experts is they will be providing us advice. The National Cabinet will meet again on Tuesday evening, and they'll be providing us advice on aged care facilities and visitation arrangements there and restricting those. They'll also be providing us with further advice on enclosed gatherings. Now, that's something they've been working on, but these are practical sort of measures as well, and they need to be well thought through, and that's what they're doing. But I want to stress something, Laura, and that is these are not absolute measures. I mean, you cannot close off every single possible risk when it comes to this. But when you do these on the volume level we're doing them, it lessens the overall level of risk that the community is placed at. And as I was explaining yesterday with those curves which show the peaking of the virus's impact, if we flatten that curve, then that reduces the stress on the hospital system, and it means we can get the support to the most vulnerable. So no one measure is going to be the knockout blow to the coronavirus. That's just not how this works. All of the measures are relative, and when they work together, it lowers the overall risk.
Prime Minister, there's been dramatic developments that Boris Johnson is moving to employ in the UK, that nursing homes will be quarantined for up to 4 months. Is that an option here?
Well, as I said, we're getting that advice on the measures we'll take within aged care facilities over the next day, and we'll consider that advice and make a decision on that on Tuesday evening. But people can expect to see a fairly significant restriction on visitation to people in nursing homes. Now, I understand. I mean, I went through this own process in my own family over the summer. When you have elderly relatives who are in nursing homes, then you obviously want to see them. It may be the last time you do get to see them, which was certainly the case in our family's experience. And so that needs to be done sensitively, and it will be done sensitively, but we need to lessen the broader risk to people in these facilities, and we also need to respect, I think, the sensitivity of families going through what is a very difficult time for them.
Are you considering the herd immunity approach, and is that part of your thinking in keeping schools open at the moment?
I'm aware of those sort of that advice that has been in the United Kingdom, and it is true that those who are younger actually are the least at risk to the more damaging impacts of the virus. I mean, the truth is that, I mean, as Paul Murray has been saying quite rightly, 8 out of 10 people, and this is what I said yesterday, who contract this virus will have a mild illness. As you know, Peter Dutton contracted it and was tested positive, and,
but isn't that
he joined the National Security Committee of Cabinet yesterday.
Particularly children with no symptoms whatsoever, could actually be spreading this.
Well, the advice, and let's be clear about this, the advice of all the medical experts from the states and territories and the Commonwealth is that at this stage that the closure of schools is not a recommended action. And whether that changes in the future depending on how this virus progresses, well that decision would be taken at a later time. Where there are incidences of the coronavirus as known and in particular schools, as has occurred in New South Wales and in Victoria, then those states have been responding to those specific instances with specific measures, and that's what those states, all states, will continue to do. But as the advice and as the information changes, then obviously practices may change as well. I mean, what we have to do is just keep meeting, keep considering the information, keep making decisions to ensure that we slow the spread, because when we slow the spread, we save lives, and that's what we're very focused on achieving. I'd also say this, Laura, you know, there are lots of opinions about this. There's opinions on social media, there's opinions in the media, there's lots of people expressing opinions about this. What we need is facts, not opinions, and the facts are what has been advised to the public, and the facts are what our medical experts are basing their decisions and their advice on.
Well, perhaps we need a Commander-in-Chief like you. We need to hear from you twice a day with twice daily updates. Are you considering that?
Well, I don't think there's been a day almost that I haven't been out in recent times. The Chief Medical Officer, I think, has been doing an extraordinary job in providing those daily updates. I think the initiative of the National Cabinet, Laura, is a very important one. We've never done this before, ever, as a country. Back in the Spanish flu, this is a 100-year event. 100 years ago, one of the things that went wrong was the states and territories did not work closely together on that occasion, and in fact they spent most of their time fighting with each other and blaming each other. That's not happening on this occasion, and I'm deeply grateful to the support provided to me by the Premiers and Chief Ministers. We're all working together incredibly well from all sides of politics with one goal, and that is to protect the health of Australians. The economic impacts I certainly have not forgotten about. They are also very concerning, and I know there's quite a bit of hardship that's coming the way of many Australians, and we need to do everything we can to try and cushion that blow as well. But we are in very unprecedented times, and it's important to keep our heads, work together, look after each other, be respectful to each other, and remembering also those basic social distancing things that can make a huge difference. No more handshakes. Make sure you cough into a handkerchief or into your elbow. Make sure you wash your hands frequently, and do all those things, and be very careful about your contact with the more vulnerable members of the community, particularly elderly. And I want to say good on you, Woolies, who are allowing elderly people to have their own shopping time at supermarkets. I mean, that's just a sensible reaction. That didn't need legislation. It didn't need, you know, national meetings to decide that. Some good common sense actions and decisions taken in the community. We can all do that each day. We can all do that every day. That's why I've always said on this, we all have a role to play, and let's just play it and keep calm, but be aware of the many changes that are happening and that will continue to happen.
Prime Minister, just finally, have you been tested for coronavirus?
No, there's no need. I have no symptoms of the coronavirus, and you know, testing resources are scarce resources, and they should be only used where the medical advice suggests that a test should be conducted. And I'm not going to break that rule. I'm going to follow the medical advice, and I encourage everyone else to do the same thing.
Prime Minister Scott Morrison, thank you for your time.
Thanks a lot, Laura.